is our name. 1220. Annus Domini, Chartres, France. The magnificent cathedral is completed. The labyrinth is its symbol. The labyrinth, the path towards knowledge. 1982, Florence, Italy. The city of Renaissance. A small company begins to develop in the information technology for the medicine. 2020, Germany. The goal is achieved. We are the most great, the most innovative, the most solid in the care IT landscape. Dedalus is our name. 1220. Annus Domini, Chartres, France. The magnificent cathedral is completed. The labyrinth is its symbol. The labyrinth, the path towards knowledge. 1982, Florence, Italy. The city of Renaissance. A small company begins to develop in the information technology for the medicine. 2020, Germany. The goal is achieved. We are the most great, the most innovative, the most solid in the care IT landscape.
So good morning and welcome to this meeting, the Future of Healthcare, Same Goal, New Means. I would like to thank all those who are connected with us from remote. I would like to thank the speakers, the rapporteurs, with whom we will have a nice talk during this meeting. We have Giorgio Moretti, Managing Director of Dedalus. Welcome to you. We have Fernanda Bassiani, General Practitioner and President of the Italian Society of General Medicine for the province of Parma. Welcome to you as well. Then Dr. Marco Trivelli, General Director of the welfare system of Lombardy, of the Lombardy region. I would like to go directly into the core of this meeting. We have organized this meeting, this special session, because we would like to take stock of what has taken place in recent months. And I would like to take stock of the lessons learned, if we have any lessons learned. We would like to understand what really happened and what we can do. Exceptional things happened. Some say that we've been overwhelmed. Other countries looked at us at the beginning with suspicion and then with great admiration based on what took place in our country. Unimaginable things took place. Great professionals worked together. University professionals learned from hospital practitioners and the other way around. And then, for example, young graduates immediately went to work in the wards to provide care to very ill patients who were suffering from a new condition, new patients with a new disease. Suffering from COVID-19. At the beginning, we knew nothing of this, and now we're still finding it hard to understand it. Our knowledge base is gradually expanding, but still, this is very difficult. It is a disease that is very difficult to understand. Typically, Italian professionals, as well as other professionals in other countries have been trained, are trained with some kind of a vertical knowledge, but this time they were faced with a new type of problem. And other things happened. Taboos have disappeared. Let me give you an example. The issue of privacy, for example, or the issue of accessing data or systems that were not accessible before and would, in a way, prevent us to access a whole series of tools related to IT systems. I mean, all of this has become of a minor importance, of a secondary importance. Millions and millions of patients have been treated in remote in their homes through telemedicine. So we used telemedicine. Everything seemed impossible, but indeed it happened. And this is the challenge that lies ahead. What kind of assessment can we give of this? What kind of lessons can we learn? And what can we give to the benefit of everybody? Fernanda Bastiani has been the real clinical, so the general practitioner. General practitioners have really made magnificent, huge efforts in recent months. So, Dr. Bastiani, what is your experience and what can we learn from that? So, good morning, everyone. I am a general practitioner. I work in the town of Collecchio together with other 7 colleagues. I mean, what has happened was a real hurricane for all of us. It had lots of negative effects, but it brought about a radical change in our way of working. Above all, we've had the chance of collaborating. We've always been very supportive. I mean, we had no one to rely on, only our colleague. We only had chats to discuss with our colleagues. And this was also the chance to communicate with our young colleagues, the ones whom we had trained during their specialty courses. There were many of them, and they really reassured us, and we have to say that they faced the situation with great enthusiasm. The problem is that, I mean, this new way of looking at patients and colleagues together, which is very much care-centered, was forgotten to us. Before COVID, many barriers had been erected, almost nihilistic times. And this has not changed because, I mean, we set ourselves an ethical imperative because of a number of events that took place. And these events, these facts, really changed our lives. And this is still the case. We are not heroes, but we were forced to be very pragmatic and realistic. We were aware of the risk. We had no protective equipment, but we had not back then any other alternatives to look after our patients. So patients who relied on us unconditionally and who have become the subject of care and assistance, a kind of care and attention and assistance that we had not imagined. So this situation was dramatic for us, but we learned a lot from it. We changed because our mindset has changed. So the first thing we did was to try, in a way, support each other. And we tried to increase our knowledge base. We wanted to focus on knowledge because this could help us, in a way, counter the anxiety we had in the evening when we came back home. This does not only apply to general practitioners, this applies to the entire health professional. Plus, regional governments, regional bodies were very supportive. Our mayor, for example, was very supportive, and we built something important together. We were all cognizant of the fact that there was a common interest. And we also took the initiative in developing new treatment options. Also doing, for example, doing remote medicine. There were things that, there have been things that we have learned and nobody had taught us. Each of us has, in a way, treated their own patients differently from the other, providing a tailor-made assistance and care to our patients. In the autumn of 2019, the OECD report would indicate that the Italian national health system as ranking second in Europe, and stated that this result was basically based on the solidity in the implementation of primary care. And within the system, general practitioners play a pivotal role. And there's an increasing number of medical staff which basically provide care to chronically ill patients and prevention services to the entire population. Over the last few months, we could really understand how territorial facilities and assistance lack resources and equipment. They were there have been sectors in the population which suffered more than others, not only because of COVID, but because of a general programming. So thank you, Doctor. And now I would like to leave the floor to one of our colleagues. I mean, all that happened has highlighted that professionals really are really professional, and their skills are put to the test when there's need. But of course, the contextual situation has to favor their work. Giorgio Moretti is the head of a multinational company dealing with IT systems, and I'm being reductionist in actually giving this kind of definition, because they do much more than this. So my question to you is the following. Shouldn't it have already been like that? I mean, shouldn't everything already be at the service of the patient? Shouldn't we already have a system in which IT systems were already at the service of the patient? And what about the others? What happened in Europe? You have a broader view than ours. You are cognizant of what happens in other countries as well. So what is happening in these countries, in the other countries?
First of all, good morning to you all, and thank you for inviting me here. I start by saying that we will never be able to replace the human value of professionals and doctors with technology. This is what we deal with in Dedalus. But an advanced use of technology can increase the quality of the relation between doctors and patients. And this is based on the quality of care. And COVID, in different ways, has made us make the giant leap forward, but unfortunately we risk that this quantum leap is not fully exploited, because this is not Zoom. We're not talking about Zoom here. We're not talking about video conferencing systems. These are not the powerful tools that are made available by technology today. At this historic time, under difficult circumstances, we have tested some technological commodities, let's say, made available by technology. And the risk, which I hope will not be a risk, is that we're going to stop here. We have to fully exploit the potential, and we have to continue going on. So today, I think we need to focus on one issue, and we need to evolve. Now, Dedalus is in 40 countries throughout the world. We are in Europe, in Germany, Spain, Great Britain, Austria. We are in many different countries, and all these different countries are all very unprepared. And they have all different systems which are connected to their healthcare systems. In Italy, healthcare is provided at a regional level, and there are many differences between the regions. What have we seen? We have seen what we really knew, that clinical processes were not really transformed by habilitating technologies, as happened in many other strategic sectors. So far, we've been using IT as a system to automate traditional models of management of clinical processes. Today, we have a wide range of tools. With COVID, we have just used a few of them. And this is due to many factors. The fact that supply and demand are both poor, as in so far we have not been really aware of how technologies can redesign processes. Let's think about how the banking world or the defense world has changed. They are very complex sectors, fully integrated sectors where there's a lot of interaction between different entities. Now, we have just had a bit of a taste, so to speak, of that. Our aim is not to have a remote reporting system. This is just a starting point. As the colleague before me has just said, we have rediscovered the relation with the patients, something we had all forgotten. The concept of remote assistance today gives us a lot of potential, much more potential than we had in the past. So hopefully, this pandemic will push us to continue exploiting technologies. Over the past 2 months, for example, in France, a lot of investments have been made on IT. 420 million euros have been added to ordinary plans. We have talked to different decision makers. Enormous investments will be made on these sectors. And I will say it very clearly. Now, if we have to spend this money to replicate all the organizational models just by automizing them, maybe, and this is against my interest, it will be worth saving this money. COVID has taught us that healthcare is mission critical. What does it mean to operate under a mission-critical environment? This is not just an environment in the operating room where there are super advanced technologies, among the most super advanced technologies worldwide. The problem is that the whole healthcare ecosystem needs very powerful tools, planning tools, command and control system in the defense world. And throughout the countries, all over the countries, we have seen that there's a lack of tools to manage emergencies. But actually, an emergency is what cannot be planned. Earthquakes in Japan are not an emergency. Very strong earthquake in Japan, that not emergency, whereas it could be an emergency here in Italy. So I hope that at this time, this is the right time for the clinical world and for the healthcare sector to cooperate together to find a common will to study the full potential of these technological tools. If we become aware of that, so I'm not talking here about electronic medical records or other remote tools. These tools can be improved by making them available to all the different entities in the clinical world and to use them under different circumstances. That exists, that already exists, so we just need to decide whether we want to continue with that. Thank you, Mr. Moretti. Now, we need to overcome, to take a step forward. So we need to go step by step, and that requires time. But reality has been faster than us. Events have been faster than us. So the problem is, how can we support the carers? Because the other issue here is that our patients have been followed, many of them, together with Dr. Trivelli. We were in Brescia following our patients. He was the general director of our local healthcare authority, and we had, for 3 times, 900 patients present at the same time in a hospital. So Marco Trivelli actually underwent the acute phase of the pandemic, and then he was called by the DG Welfare. Now, this morning, he heard the professionals who are the representatives of the regions and the territories, the general practitioners, the family doctors, the ones you have chosen and you relate to, who are in first line. One of the remarks made is that we need tools for care. We need real tools. We need to provide answers to patients. So now that you are working for Lombardy and you are managing welfare in Lombardy, and this is a very daunting task, and you have experienced the situation in Brescia. What can you say after your colleagues? Unfortunately, we can't hear the speaker. It's probably on mute. The speaker is probably on mute. Good morning. The 2 colleagues have given me a lot of food for thought. Dr. Bastiani said that this experience has been an experience of radical change in medicine and in the exercise of medicine. All the clinical histories I have experienced and I have heard over the past few months share this. And Mr. Moretti, Dr. Moretti said that we are very close to a quantum leap. Now, these months have shown that we are very vulnerable in our healthcare system. Let's focus on vulnerability. COVID has shown that we are vulnerable. And we've seen that in the months of March and April, where the epidemic was acute, where we could actually see and touch the quantum leap. And many of us had the idea, had the impression that we couldn't go back. The experience of these months is teaching us that our organizations are somewhat suffering from inertia. And what we've clearly seen is that all of us, all the organizations, all the people dealing with healthcare have a great clinical passion and mission. Not only the professionals who have been working with passion, and this is the reason why they have chosen this job, but also all the other people working in this sector. This care, this ability to take care of patients has been growing over the time. But this is not enough in order to take care of people. Professional skills are not enough. Personal skills are not enough. Passion is not enough. Today, we have seen that over the past 10 years, we've been working without creating added value with our job. We work very hard, but without creating value. So our work is not increasing the wealth of our country. Economic crisis continues. And why is it so? Because of the way we approach work. And this can be seen in many different ways. You can conceive work as a way to express your skills and your professional skills, or else you can conceive work as a way to give value to society, to the world, and to patients in our case. When you conceive work as an expression of your mindset or of your skills, sooner or later you fall into a role, and all the organization seems that is made for me to express myself and what I am. Whereas what is done in work has to be done in order to meet some needs. And this is where we need professional skills. This is what happened during COVID. All of a sudden, all the constraints which we have in our organizations, and this also applies to all major multinationals, and also Dedalus, led by Moretti, may have the same constraints. The emergency, what happened in March and April, has caught the attention of people by making them forget what their role was. They didn't think about what they had to provide, but they changed the way they provided their skills. Throughout Italy, we were able to change our path of care because there was a real need to meet. And this is what we had to do, meeting patients' needs. So when you have to play a role, you provide an answer the way you can do it. When you focus on needs, actually, you change your approach to work and you go beyond your boundaries, you go beyond your constraints, your limits. This is why we've been able to use tools which, until some months ago, were poorly known. Even though probably Mr. Moretti already knew it, for him they're already old-fashioned. For example, the electronic medical record, everyone has learned to use it. These tools are not yet distributed among all users. There are not a lot of IT skills in medicine and in the healthcare sector, and this is what we need to invest on. However, we were able to meet the need, to understand the need and to meet this need, and we were able to change. So we have overcome the limits of our organization, and that thanks to the great professional skills we have at all levels of our organization. However, that requires passion, vocation to care. We need to think by targets that requires the ability to cooperate, to interact among people and to work together. Evolving in a constructive way really depends not just on skills, but also on the willingness to consider the needs, adopt a new approach without taking anything for granted. And we need to be fully involved, personally involved, because through our role, we can also not just express our professional skills, but also our personal skills, which was something we were able to do in March and April.
Okay, we have a couple of minutes at our disposal. I would like to ask one question to Fernanda Bastiani. Today, with us, we have Dr. Trivelli. He is basically representing, so to say, the institutions, and then the CEO of a multinational that provides tools which might facilitate our action. So my question to you is the following. Do you have a question to these two people? Because probably public bodies are not that fast, but then when they move, when they start moving, they have a great influence, they have a great impact, and their inputs eventually reach the final patient. I mean, these are then translated into tools that you as a doctor can use. On the other hand, Mr. Moretti, with his company, has the capacity of looking, of being more farsighted and possibly identifying possible future scenarios for future investments and to identify solutions that can be used in the future. Probably because in the future, over the next few weeks, we might have yet another problem, and was we will have to take into account that our reality has changed. So, you have the floor. Well, first, I would like to thank Mr. Moretti and Mr. Trivelli. Their words have been really reassuring to me. the way ahead to face the future has to be grounded on the experience we've made. The experience and the limitations concerning what were not able to do kind of pushed us to go beyond. So the question to Mr. Moretti is, I mean, there's this prospect which opens up, which is really fascinating. How can this be an interesting challenge for general practitioners who, in this given time, have the need to, in a way, stratify the risk for their patients, identify the risk for their patients before this risk is translated into a fully bloomed pathology and a hospitalization. In other words, we can no longer be passive. We cannot afford ourselves to be passive and wait. We have to be proactive. We've always done that in the past, but actually we have to go on along this way. So stratifying the risk of patients, especially the ones who had COVID and who have to be monitored. Then stratifying the risk of patients who are stable, but who have multiple conditions which have to be monitored over time through screenings and controls and checks. And then patients who are at high risk because they are not stable, so we can no longer treat them as we were considering them before, or patients who are in palliative care because they underwent surgery, or patients who are waiting for them to be carried out. In other words, we have to be very precise in stratifying the risk for these people to prevent the worsening of their conditions. In this respect, how helpful can telemedicine be of help for general practitioners, so that general practitioners can, maybe through appropriate software programs, identify certain categories of patients? How can this become a reality in our work? So, Mr. Moretti? Well, first, I would like to basically congratulate Mr. Trivelli for the work he has to do, because it is really a very, very difficult task. I mean, my company is a private company, and because it is private, I had the chance of setting up a group of professionals which support the company. So I really understand how complex his work is. I understand what he says when he talks about cooperation or the recruitment of players, so that these players are all part of a common scenario. I mean, what you said is really clear to me. And then to answer the question by Dr. Bastianis, I would like to say that when it comes to general medicine, for example, we serve 6,000 hospitals in the world and over 30,000 general practitioners in Italy, just to give you an idea. So clearly, this separation, the many ways we could use to define them. I mean, we've organized lots of congresses and conferences on the continuity of care, conferences on new models. I mean, when everybody says, for example, you go to hospital, you go to hospital. But in Italy, there are lots of different ways to refer to the kind of assistance that is given to patients. We have primary care and other fields. Abroad, this is not the case. I mean, clinical practice is the same at the Mayo Clinic or in a Zambian hospital. So to answer the question by Dr. Bastiani, I mean, we have powerful tools. We have a tool which is available for general practitioners that has been placed to the disposal of the General Society for General Medicine. This is the COVID Vulnerability Index, which basically provides for warning. But I think this is not enough. I mean, I would not like to be too much far-sighted, but paradoxically, all the tools, most of the tools we have today are available. However, there's deep fragmentation. There's lack of a common vision on the clinical process. So the general practitioner just does a bit of the job, but he or she won't be able to do it well and entirely unless he or she is in close and direct correlation with the rest of the system. So the ability of providing tools, which are enabling tools, as we call them, like, for example, staging systems or precursive medicine tools, for example. I mean, these are tools which are already existing. I wouldn't like to regret this situation. We have to say that we're the biggest in the world. We rank second only to the United States in this respect. But I would very much like my country really fully exploiting the potential of these countries compared to other countries that have already embarked on this path. Of course, this requires strong will. It is not a matter of money alone. This is mainly a matter of will and determination. We have to be willing to overcome the situation. I mean, how many general practitioners use all the tools available? Not all of them. What Mr. Trivelli said is really true. I mean, the use of first, second, or third generation technologies is important. I mean, we're currently working on the 5th generation of tools, but the very simple fact that a doctor works with 3rd generation tools already produces added value. The very same fact that they use tools of 3rd generation, which, however, are integrated in a whole system, of course, deeply changes the relations between doctors, which is fundamental, and between doctors and their patients. What COVID has shown today, and we've done a lot of work on this, for example, abroad in Albania and France. I mean, COVID has shown that there should be tools with which patients get in touch with their doctors, maybe through an app. And all of this helps us anticipate our activity. Information is quicker, it is shared. We can even add, for example, predictive medicine tools. I mean, I wouldn't dare to talk about artificial intelligence. That's, of course, useful. But still, today we have very powerful tools to share best practices, and they can be made operational immediately. This is yet another thing that COVID taught us. One of the most critical elements of the first days of the lockdown, I mean, after a couple of months in which different modalities of treatment and diagnosis were being experimented in the world. I mean, all of these tools were still being circulated too slowly, including among general doctors. So, in other words, how can our diagnostic and clinical best practices become available to my colleagues in real time? It is possible. This is possible today. There are powerful tools, but we have to set up to use them. We have to make up our minds and decide to use them. For example, fortunately, I was not against telemedicine, but if we use telemedicine properly inside the system, within the system, everything becomes easier to manage. For example, Mr. Trivelli gets information in real time, Dr. Bastiani talks to her patients in real time, and all the information is shared at the various levels. I mean, today, the paradox is that everything is possible. So, I really hope that we can make some kind of a qualitative leap on this. Not so much because of the investments, but rather because we need to be willing to understand how these tools enable us to change the way we work. Thank you, Mr. Moretti. We have 3 minutes and a half only. Marco Trivelli, Fernando Bastiani and Moretti have provided me with very interesting food for thought, and I'd like to focus on this. Let me briefly summarize. There's no need for us to do. There's little time to plan, but actually in a couple of minutes, decisions can be taken which will ultimately impact on the working conditions and the care. The tangible tools that can be used by general practitioners to facilitate their work in terms of diagnostics. And then another interesting aspect is the real policy on the use of the tools that Mr. Moretti was mentioning, that has not to do only with resources, financial resources alone. No, it's not only that, because we do have the resources now, but we need to focus on how to better facilitate the diffusion of a mentality in which these tools are useful for the professional and for the patient. Concerning the fragmentation of existing IT tools, this fragmentation testifies to the fact that there is professional fragmentation. Technically speaking, in the operation theater, we have premium quality technology which can immediately be used. However, when it comes to connection, in other words, when it comes to the operational expression concerning the possibility of cooperation between professionals, this does not exist. This is not present. So the tools we can provide are the ones which should enable today to exchange information, opinions, consultations between general practitioners and hospital health professionals. And technically, I believe that there are no difficulties in this respect, but we need to, in a way, to promote reciprocal attention between two different worlds. They have to be, in a way, enhanced to communicate. In diagnostic, as regards diagnostic tools, they have evolved a lot over the months. The virus at the beginning was unknown, and after 2 months we had approximate diagnostic forms. But at least 4 or 5 generations of IT tools when it comes to diagnostic are concerned, and they're even more promising. Everything is still very approximate. We cannot talk about certainties on a virus that was discovered only 8 months ago. But this rapidly evolving diagnostic tools also helps us speed up the time by which results are given. All these times, all this information have to be shared in the field of urgency medicine, but also with hospital doctors. This is a great tool which over time might limit the need for isolation. In other words, this is not to be confused with the lockdown. That was a condition that enabled us to limit the spreading of the virus as much as possible. Quick diagnostics for everybody might limit the needs of the lockdown, but at the same time, it can also limit actually, it might enhance the importance of individual behaviors. What you have just said should be a commitment on our part. All of our country in this moment is behaving like this. In other words, it is providing the health professionals with the right tools. First of all, differential diagnosis tools, and then the possibility to continue the constant and direct engagement with their patients, like Moretti said. And this has to take place within a scenario which basically tells us that reality is constantly more ahead of us. If you're dealing with people, you're constantly kind of overpassed by events. We have all been hit by some kind of an ice perfect storm. We were convinced of the fact that we could face any type of problem, and instead, in fact, this was not the case, because we've understood that we need each other. So by way of conclusion, this is something that was often mentioned by more authoritative people behind me. I mean, we are on the same boat together, and we have to take stock and capitalize on what has been taking place, on what has happened, to learn from our experience. Thank you very much. Bye-bye.
Dedalus is our name. 1220. Annus Domini, Chartres, France. The magnificent cathedral is completed. The labyrinth is its symbol. The labyrinth, the path towards knowledge. 1982, Florence, Italy. The city of Renaissance. A small company begins to develop in the information technology for the medicine. 2020, Germany. The goal is achieved. We are the most great, the most innovative, the most solid in the care IT landscape. Dedalus is our name. 1220. Annus Domini, Chartres, France. The magnificent cathedral is completed. The labyrinth is its symbol. The labyrinth, the path towards knowledge. 1982, Florence, Italy. The city of Renaissance. A small company begins to develop in the information technology for the medicine. 2020, Germany. The goal is achieved. We are the most great, the most innovative, the most solid in the care IT landscape.